From the studios of the Optimism Institute, welcome to the Blue Sky Podcast. I'm your host, Bill Burke, and in every Blue Sky episode, we'll be speaking to leaders, researchers, and thinkers whose stories and insights will remind us that there is always blue sky above. Sometimes you just have to get your head above the clouds to see it. My guest today is Dr. Tami Benton. Dr. Benton is the psychiatrist in chief, executive director and chair of the Department of Child and Adolescent Psychiatry and Behavioral Sciences, as well as clinical director of child and adolescent psychiatry at the Children's Hospital of Philadelphia. In my conversation with Dr. Benton, we discussed a variety of topics, from how she chose to do this difficult work to how the field of child psychiatry has changed in the more than 20 years that she's been practicing. We talked about the changing mindsets around the importance of mental health and efforts to remove stigma on the subject. Dr. Benton also described what it is about her work that keeps her hopeful and optimistic about the future. And also, near and dear to our hearts at the Optimism Institute, Dr. Benton emphasized the importance of instilling a sense of optimism and hopefulness in children and how much this can help them as they develop. Dr. Benton earned her MD at Ohio State University School of Medicine, did a residency at Albert Einstein College of Medicine, Montefiore Medical Center in the Bronx, New York, and her fellowship at Albert Einstein College of Medicine, Montefiore Medical Center in the Bronx as well. She's board certified in child and adolescent psychiatry, pediatrics, psychiatry, and psychosomatic medicine. It's a pleasure and a privilege to welcome Dr. Tami Benton to the Blue Sky Podcast.
Thank you. I'm so glad to be here with you today.
It's a pleasure to have you and a real honor. I wanted to start with getting an understanding of what your path was to where you are today. You are a leading child psychiatrist at a leading institution, the Children's Hospital of Philadelphia. But I know from research you didn't come out of the womb knowing that you wanted to be in child psychiatry. How did you land in this place where you are today?
Yeah, well, it's an interesting question because I didn't start off thinking I wanted to be a child psychiatrist. In fact, I didn't know what a child psychiatrist was until I went to medical school. And I was pretty sure when I went to medical school that I wanted to be a pediatrician or an OBGYN. And then as I went through medical school, I leaned more towards practicing OBGYN because I thought children were confusing and I didn't understand them. And so, but as I went through my rotations, I found that child psychiatry in many ways offered the best of all of our opportunities to work with young people and families. And that's because not only did we have an opportunity to understand all the physical things that were happening with kids when they're ill and when they're healthy, but also, how do you improve their capacity for living a healthier life psychologically, which is really important. And so, all the physical health work that I do is, as a pediatrician, because I'm also a pediatrician, I couldn't decide between the two. That work is exciting, but what's really exciting is introducing the idea of all the possibilities for young people, all the things that they can do with their lives, and how to help them manage themselves so they can be most effective in achieving their goals. And so that's what really inspired me to pursue child psychiatry. And I haven't been disappointed.
It sounds like you try to instill a sense of hope and optimism in young kids, which is an increasingly tough thing, I think, in this environment.
Yeah, so I think that's, as much as I like working with adults and I enjoy being an adult, I really enjoy working with young people because there is so much opportunity, so much flexibility, so much growth. And, it's interesting, kids are just naturally happy and optimistic. That's how they start off. I mean, kids are supposed to be full of joy. And when you look at toddlers, it's what you see. And, maintaining that sense of anything is possible is really, really important. And so it's what I find exciting and at times challenging in working with young people across the lifespan. But that sense of you can do anything that we see with children and adolescents is actually really inspiring. And it's what keeps me excited about my work, even when the situation's not great. Because as you can imagine, as a child psychiatrist, kids aren't running to come see you. And usually, when they come to see us, it's challenging because they come in with their families having a problem with something that they're doing. And we have to try to find a way to engage them in addressing whatever that problem is, while at the same time trying to introduce a perspective that's actually helpful for the young person.
It's funny. I hadn't thought of it this way when you say they're coming in for something that's wrong with them. That happens in traditional, pediatric visits, but there's something about the mental health component or behavioral health component that's different. In other words, no one's blaming the kid for getting strep throat. But if the child's acting out or having depression or something, it's like, what's this kid doing wrong? It's a very different dynamic. I never really thought of it that way.
It is, and it's interesting because there are times that families come in, and the families have just been getting sort of hammered by the schools sometimes, right? Your kid's a problem, your kid's disruptive, and it feels bad for the parents. And so when they come in, they're typically it's something happening that's problematic, and people do tend to blame parents for their kids' behavior. No matter what, it's hard to, when families come in feeling that they're being blamed for stuff, it's because frequently they are. And, so many times it's not the parents and it's not the kid. It's environmental circumstances and factors beyond their control that are contributing to behaviors. And then the challenge for me sometimes is starting off by changing the narrative. So you don't get high yield by bringing the kid in saying the kid is bad and he's always been bad. You
Yeah.
really have to really kind of shift that conversation to focusing on the problem and not the person, and how can we change it? And a lot of times I find that kids are just afraid. Okay, they're getting lots of different inputs in school, in the community, from other adults. If they're struggling, it's just hard for them to figure out how to be effective and be successful. And that's important to everybody, but it's especially important to kids.
We certainly can talk about social media. I think one of the challenges too, and am I right? You've been at this more than 20 years now?
At least.
Yeah. So you've seen a lot of change. There was no social media, and I don't like to blame everything on that, but I've heard it described as when you're on social media, you're comparing everyone's outsides to your insides.
Yeah.
And so this external picture that people present of themselves, and then you're feeling this other thing that's very different. You think there's something wrong with you. And so I'd be curious to know, I know you work with a wide range of kids, and some are too young probably, hopefully, to be on social media, but has that changed what you see presenting in your office over the years?
It has, and not all bad, but definitely for kids who are struggling, it can be fairly negative. And so, one of the things we saw during the pandemic is a lot of families used social media to keep kids connected in positive ways with friends, with family, and all of that was quite supportive for quite a few kids, particularly those who were more anxious. The challenge really gets to be how much young people are engaged in social media and how much adults in their lives are aware of how they're being engaged. And so, for example, spending all your time communicating with people through social media is really not, they're not real interactions in the way that being in a group, having to interact with people, it's really different. For some people, for some of the young people, that's kind of all there is. And, we also know that for young people who are struggling, like if you're anxious or depressed or you're struggling with the eating disorder, there's a tendency to be attracted to those sites that focus on those specific topics. And they're not all positive. And so, what we found is for kids who are struggling, some of the interactions on social media are really quite negative for them. And then, there's the episodes and incidents of online bullying. And all the other stuff that happens in real life is much more concentrated with social media. And then unfortunately, it can become a vicious cycle because social media gives you constant access to others. And so if there are people who are being negative, it can be really hard for young people, actually for adults, for anybody, to kind of pull away from that. And so, one of the things we're really asking families to consider and to think about is limiting the amount of time that, that young people are actually spending on social media. Now, as I mentioned, it's not all bad. Okay, some of it's positive and supportive, for young people who are quite anxious and don't necessarily want to be out in the community all that much. There's some things that can be beneficial. And we actually use social media too for some psychological support for young people at times. So I think it's how it's used, but right now it's just not enough structure and sort of guidance around what's out there. And I think that's the challenge. It's hard with teenagers. Teenagers don't want their parents in all their business, and I understand that it can be a source of conflict in families. But I do think it's important for parents to put some guardrails around how much and how often and what their children and adolescents are being exposed to on social media.
There are a few things Dr. Benton mentions here that I'd like to spend some extra time on. First, she says we should, quote, focus on the problem, not the person. Of course, here she's talking about the patient she works with, but in looking at that statement more broadly, it seems like it could be a great maxim for so many other things. Imagine, if you can, what our political discourse would be like, or discussions on social media, if we focused on the problem at hand and didn't turn everything into a personal battle. Tami also points out that social media is not all bad, but we need to realize, as she says, that these are not real interactions that you're having with other people. And I remember in the early days of Facebook trying to reinforce to my own children that despite what the site was saying, they didn't really have more than 100 friends. Dr. Benton also made the point that another issue with these platforms is they often feature groups that are focused on some of the very worst problems kids are having, like eating disorders, bullying, and others. And we really need to do what we can to understand what our kids are being exposed to. But Dr. Benton also wanted to emphasize that there are plenty of positive applications on the internet, and I asked her what some of these might be.
Some of the social media sites really focus on skill building. And so for some folks who are interested in science, who are interested in arts, they have access to large communities of people who are interested in those things. I had a conversation with one of my adolescent patients a few weeks ago who talked about the fact that they're on Facebook. And I was explaining, I can't be on Facebook because I can't keep up even with my email, let alone Facebook. But they explained to me that they not only use it to keep in touch with people, but they also find ways to talk to people they otherwise never would be able to talk to. So other people who are artists or musicians, they're able to actually engage in conversations and get advice from those people and share ideas. And so I think those are some of the positive ways that folks can use social media. And a lot of the adolescents actually are engaged in those activities, which I think is great.
You've mentioned the pandemic a few times and the challenges that kids have. I was having a conversation with someone recently, and we were talking about the last several years. Let's say you're 12 years old, and let's say, the political unrest and that whatever you think of the last president, the last 6 years or so have been difficult in those terms. So, half your life if you were 12. Let's call the pandemic 3 years, a quarter of your life in pandemic, your entire school life with shooter drills. I mean, we have put things on our kids, we or the pandemic, that's really heavy. And I'm wondering how you've navigated that, how you think about as we come out this other side. Because I've also heard some research that's interesting that shows that it's too early to say, but there's a hope and a sense that some of these kids who've been through the worst of these things and bullying and that sort of thing are coming out the other side with an incredible resilience and a self-knowledge, if they've done the work with folks like you, that could make them much stronger and more empathetic adults. So that's a long question, but I'm curious to know your thoughts as we hopefully are emerging from this pandemic, what you're seeing that's different and challenging, but also what gives you hope.
One important lesson I think we've all learned from the pandemic that I hope we will use to grow as a country and as a world is how much our environment impacts our mental health. Okay, I think that's the one lesson that, in case we wondered, we should know. And one of the things that we are seeing and we anticipate will continue is that some young people, just like the adults, will continue to struggle after the pandemic, and we anticipate it early in the pandemic that we would start to see higher rates of anxiety and depression as we move forward, because we were seeing that in young people as the pandemic progressed. That being said, it also provides an opportunity because it's more proactive, right? So, I think we used to think, well, these things just didn't happen to kids. And
Hmm.
if they did, it's uncommon. Well, it's not uncommon. It's actually common. But we also, fortunately, at this time in our history, have so many ways to address those things and prevent them, right? Because we know that things happened during the pandemic that place us all at risk. We know over 200,000 kids lost parents during the pandemic. But we also know how to support kids who are grieving. We know how to do that proactively. And, the pandemic's really not over. So kids are still experiencing things. What can we do in the environment, the community to support the resilience that you identified? And, we know how to do that. Okay. We know that kids need to feel supported. They need to feel heard and identified. They need to know that there are adults and others around them who will support their well being. They need to be able to accomplish things, to do things. We know those things support health. And so we have an opportunity to integrate those things into school curricula, into our faith based communities, into our recreational programs. Like, we know what to do to support healthy emotional development. And we have an opportunity at low cost to actually integrate these elements in our day to day activities with young people. Doing those things, we know that they help people move forward and they'll help our kids move forward. So we are facing some extraordinary challenges, but we've never been better prepared to address those challenges than we are right now. And one of the things that really made me much more optimistic about this was, the recent bipartisan congressional activity we saw around mental health. And, I'd actually never seen that level of bipartisan support before. And it was
Right.
inspiring and gave me hope that we can do it. But we have the tools, we have the support, and we have the opportunity to make this country better for our children's mental health. So I think there's, like, all the indicators point towards us being able to be successful. The pandemic also caused us to pause, right? And think more
Sure.
about how much time do we actually spend with our families? What are we doing? When we couldn't go out, we did stuff like played games, watched movies together, set up movie video projectors in our backyards to watch movies together on a sheet. We did all kinds of things we didn't do before. And those are the things that really sustain folks. And if we do more of that, it can make us stronger.
Absolutely. And I know in my family, my children are now 28 and 26, but they both came home during the pandemic. And a lot of my peers who had been empty nesters, which I like being an empty nester. It's not the worst thing, but it was lovely to have our kids home again. And, our generations before us, that was very common. You'd have 2, 3, sometimes 4 generations under one roof.
I selfishly say that one of the things I did appreciate about the pandemic was having my son home from college. And, they went off like they're supposed to do.
Yeah.
But I think the pandemic gave us an opportunity to spend a little more time together.
And some of us too spent more time in the outdoors, walks, observation, noticing birds they never noticed, that sort of thing. I'd love to talk to you about your thoughts on the role of getting kids outside, getting them active. There's a book, and I forget the title, but the gentleman coined the term nature deficit disorder, which I thought was very it's The Last Child in the Woods, I think is the name of the book. And he talked about this issue. This is probably a 20-year-old book, so this is not something new. But I wonder about kids, both whether it's, they're on their screens or they don't live in a neighborhood where they feel safe, or whatever the various reasons are why kids don't spend as much time outdoors. Is that something you emphasize in your work to try to get kids outside and active?
We do. And one of the things that I love that comment. And yes, we emphasize families being outside together. We did learn during the pandemic that people did better, had more access to green space. And so we sort of knew that. We knew that. And then we had to think about it again. And so definitely having the capacity to be outside in green space is actually really important and for psychological health. And, one of the things that we're seeing is that, for some of the kids who live in the cities, particularly kids who live in crowded urban areas, areas that are under resourced where you don't have green space, it really actually contributes to a decline in the functioning and mental health. And one of the things that when we think about what can we do to support healthy mental and emotional development, one of the things that we can do is really in our own communities support the creation of more green spaces for young
Hmm.
people to have access to, because it does feel like nature deficit disorder. I like that because that really is
Yeah.
a real issue for young people. So in our practices, we actually encourage families to spend more time outside, but also, we have so many underutilized resources that actually could support those goals of greater exposure to being outside, like school sports. I mean, kids who engage in team sports, they don't have to be great at it, right? They just need to be there.
Right.
It really supports healthy emotional development. And, but those are also opportunities for kids to be out together and to be outside together and to be engaged in structured activities together. Having kids do more nature-based stuff at schools. I know that, we've sort of cut back on some of those things, but those things make a huge difference. And families doing those things together actually starts to teach kids about the importance of being out in nature together. It really sets a good example for how to manage stress, and how to give yourself some time to be mindful and thoughtful and to exercise, all of which are healthy.
It's great to hear Dr. Benton's optimism here. She points out that, quote, "We've never been better prepared than we are right now." And for someone who's worked on these issues for so long, bipartisan political support for mental health finally is clearly extremely inspiring. She also points out that even the pandemic had some silver linings, like offering extended families the chance to spend more time together. We also talked about the outdoors and the benefits of being outside, and I looked it up. Nature deficit disorder was coined by Richard Louv, spelled Louv, in his 2008 book, The Last Child in the Woods. As we get back to our conversation, I want to give a heads up that Dr. Benton and I are about to cover some topics that might be sensitive to some of our listeners, including some of the more serious mental health conditions and suicide. One of the things I've never worked in medicine, but I've been a volunteer in board positions, that sort of thing. And I have a huge admiration for physicians and nurses and PAs and all the folks who take care of patients. One of the things, though, I've always thought would be such a challenge is that things don't always work out, right? You have to deliver bad news to loved ones when things go wrong. And in the field of the mental health work that you do, you deal with some really tough stuff. And so I'm curious to know, just sort of for yourself and as a lesson for others, how do you stay resilient and positive and upbeat when you see a lot of tough stuff, I'm sure. And how do you sort of shore yourself up to continue to do this very difficult work?
You probably are aware, as most people are, that it's really been a challenge in healthcare to avoid burnout and stress and to maintain a sense of optimism about your work. I am susceptible to that, just like all the rest of my colleagues, and so it's not always easy to do that. And I think a lot of times we don't. Okay, and as a result, we're finding that more people are leaving our field. Many people during the pandemic and after the pandemic retired, and left the field. And we're struggling to prevent provider burnout and to support our own mental health. And we're making more focused efforts to do that. I think, when I was developing as a physician, there was really no focus on that, right? We're supposed to be filled up by your commitment to your work. And you know what? That is quite fulfilling. But, at the
Sure.
same time, you're also a human being susceptible to all the same forces as everybody else. And so we have started to focus more on how do we protect our own health and using some of the strategies we use for our families, more green space,
Yeah.
getting out, having time to de-stress. How do we do things to make our work more efficient? And we're starting to make some gains in that area. I will acknowledge that, in mental health, it is a different kind of stress.
Yeah.
In addition to the hours, some of the stories are like really heavy and painful. We get a lot of support from each other. I work with a lot of colleagues who understand that stress, and we try to build in that support for the work that we do. I mean, I oversee a mood disorders program and a suicide center, and so it's challenging. But I also think that in addition to the support from my colleagues, trying to take care of my own mental and physical health more, as part of that is the patients themselves. Okay. And, at the end of the day, they do better. Okay. And you recognize that it's really a partnership, and they want to do better, and that you can actually help them feel better and be more productive. And I think for me, at the end of any encounter with any patient or their family, that outcome continues to inspire me to want to continue to do the work that I do. But it takes some focus and effort, just like we say for our families. It takes effort sometimes to look out for your own health, but it's important to make that a regular part of your lives. I'm working on that myself, along with my colleagues.
Yeah, because on top of everything else, like you said, people are leaving the profession. Not as many people might be coming in. So on top of everything, especially is my understanding of behavioral health care, there's such a shortage of practitioners and such demand. And how you keep up with that, it's just got to be brutal.
One of the things that we're doing and we need to do more of is we need to establish more partnerships, so that, when I think about, the impact of mental health professionals, I mean, there definitely is a shortage. There's a shortage in every area among psychiatrists, psychologists, social workers, therapists, and we need to really support that workforce development. And there is a lot of effort focused on doing that right now. I mean, the federal government has been really supportive in providing more funds for training. But there's some other things we need to do in addition to increasing the number of professionals. And we need to form different kinds of partnerships. So, healthcare definitely impacts mental health outcomes, but a smaller impact than many other things, because kids live in many systems. So they live in schools, they live in communities,
Right.
and all of those individuals are important partners in promoting mental health. And so there's some ways for us to think about, how do we use people more effectively? How do we use adolescents and adults who have been affected by these conditions, either themselves or family members? How do we use them as partners in supporting mental health? How do we use teachers as partners? How do we use members of the community? Can we provide some basic skills for community members to recognize when folks are struggling and to be able to support them? And so we're actually working on, how do we diversify the workforce? Because it's not all the professionals. When a kid comes to see me, they see me for 1 hour in a week. And then they go back to school, they go back home, they go back to their friends. They're on a sports team, they go to their sports team, they go to their church, they go wherever they go. How can we engage all of those parties in supporting the mental health of young people? And I think that's how we're going to help to support our workforce.
I was exposed to a concept last year that I'd not heard of before, and I'm wondering if you've had experience with it or are an advocate of mental health first aid. And it was described to me as, it's essentially, you learn CPR. So if you're on a bus and somebody has a heart attack, you might save their life. This is trying to help people in a similar way to spot what could be emerging, mental behavioral health issues, whether that be teachers who get trained, hospital workers, or just average citizens. Is that something you're familiar with and that you'd advocate more dissemination of?
Yes, yes, and we're really involved in really doing a lot of mental health first aid training, or psychological first aid training, and actually, there's been the development of mental health first aid training for adolescents as well, so that
Really?
young people can recognize when their peers are struggling. And I like the approach, because it's really a public health approach to giving people the tools to have these conversations. And what you just said is spot on. When someone grabs their chest, we think, oh, they might be having a heart attack, and we react. We really need to do the same thing about mental health. And mental health first aid helps you learn those skills. One of the things that I hear from people often, and I think this is the tricky part, and I think this is where mental health first aid or psychological first aid, because they're similar things, how it helps. And that is that, people say that sometimes they see people struggling, and they just don't feel like safe walking up to them saying, I see you struggling, because
Right.
they're worried the person will get upset or feels, stigmatized. And, I've heard people who were like in clear distress, walking down the street sobbing, or walking through work teary eyed. I've seen it in my own workplace. And nobody feels comfortable saying, "Are you okay?" because
Right.
they're fearful. So, mental health first aid teaches you how to have those conversations with folks as well.
No, I think that's huge. What to say, what not to say. Yeah.
Yeah, and how to be okay with asking, because people want to do that, but it's amazing at times. I hear other professionals say, I'm not even sure what I would say. Like, will they get upset that I think they might have mental illness? I don't know. I mean, if you see a man that potentially having a heart attack and you call 911, are they going to be upset about you getting involved in their medical business? Probably not. And so I think it's a way to create a language for people to be able to have a conversation.
I think, and one of the reasons I'm optimistic about the field that you work in is this slow removal of stigma is pretty powerful. I mean, I'm a former bad college athlete and a fan of sports and stuff, and listening to these manly men athletes go online and talk about their mental health struggles. If you told me 20 years ago that you would see that, or there's just so many ways I feel like this is becoming a discussion, and it was put into high relief for me a few years ago. I was talking to someone who had a child at the time struggling with cancer, and was talking to a friend who had a child struggling from severe mental health stuff, and the town knew that this person had attempted suicide, and they were commiserating. And one of the people said to the other, "Well, at least your child has a casserole disease." And referring to the cancer, what do you mean? Well, when your child has cancer, people come over to your house with casseroles. When your child's home with mental health issues, people head for the hills and don't know what to say and stay away, and they're scared. That's changing, I think, but it's a big thing to get over. But I think it'll help when you see these, leading athletes and people in the public sphere, artists, musicians. You're hearing more and more people taking a break from their tennis circuit because they need to take care of their mental health. That's a big step, I would think.
It's a huge step, and I have to say honestly, I've been so proud of the way that the athletes, the actors, everybody, right? The regular people who are famous have come out to kind of talk about that experience. And you know what those parents discussed was accurate. When your child has an obvious physical illness, people are feel much more comfortable expressing their sympathy. But there's also that shift that's happening, where it used to be that the parents were blamed if your child was having behavioral problems or mental health problems. It's just bad behavior. You can change it. I think we're moving away from that kind of thinking and understanding that these are biologically and environmentally induced disorders that young people are struggling with. And then we also recognize that they're episodic, right? So for many young people, they may have an episode of depression or an episode of extreme anxiety that we're able to actually address and improve, and kids can move on with their lives. And so, but I think that the athletes speaking out about their own experiences just really highlights for people how pervasive these experiences are, and in some ways have started to kind of normalize the discussions about mental health, which I think will make a huge difference. Because as I was thinking about this discussion today, one of the things that really struck me is when you talked about optimism. It's really the absence of optimism is at the core of many of the experiences that young people and adults have that contribute to things like anxiety disorders. When we talk about anxiety disorders, which are increasing in frequency. And recently the U.S. Preventive Services Task Force has approved screening for anxiety in primary care now for children. It's not just the pandemic. I mean, I think the pandemic and national unrest, what's in the media, what's happening in the country, making people more anxious. But when we treat anxiety disorders, one of the major focus of treatment is to help people shift their perspective and not to expect a negative outcome. And so, for anxiety disorders, one of the root causes of anxiety disorders really has to do with this expectation that things are not going to work out. that
Yeah.
things are going to have a bad outcome and many times a catastrophic outcome. And so much of the work is changing that, right? And helping people have a more realistic perspective on what the options are. So, it's a difference between fear and anxiety because, fear is actually the anticipation that something really bad will happen. And sometimes that's justified, right? So if there's a pit bull that you've never seen before growling at you and jumping at you, you should be fearful that something could happen. But anxiety is really about fearing something that is likely to never happen. Okay. And it's because, with anxiety disorders, we frequently go to the most catastrophic outcome. This is I'm gonna give a talk and I'm gonna bomb and everybody's gonna think I'm really terrible. When maybe you've given talks 10 times and that's never happened. So it's really trying to, shift people's focus on what the potential options are. And so optimism, thinking that things can work out or that things will work out really shifts your ability to approach most tasks and really contributes to a happier, more fulfilled, and rewarding experience. Optimism is a key factor in supporting resilience and teaching our children that sometimes things don't work out. And you just keep trying. You get back up, you pick yourself up, and you keep going.
There you heard Dr. Benton say some remarkable things about the power of optimism and how a positive and hopeful outlook can directly impact our health. She also raised an interesting point about the difference between fear and anxiety, with the former being rational and reasonable, but the latter is more obsessing on the worst things that can happen, a condition that can be truly debilitating in some cases. I also want to go back to our discussion on mental health first aid. Training for this is increasingly available around the country. So if you have an interest in learning more, I'd encourage you to simply Google mental health first aid and see what classes might be available in your area. Getting back to our conversation, I mentioned to Dr. Benton that in preparing for this interview, I learned about the new Center for Advanced Behavioral Healthcare at the Children's Hospital of Philadelphia and watched the opening ceremony online. And I really wanted to hear what she had to say about this new facility. For listeners who don't know, the Children's Hospital of Philadelphia is a worldwide leader in as far as children's health systems and hospitals are concerned, really sort of a beacon in that world. And to see the resources that have gone into this new center, I'd love for you to talk about what it is and why it's important. As you took the stage that day, you were choked up. You seemed very excited and emotional about this. And it seems to me that for the Children's Hospital of Philadelphia to put these kind of resources into behavioral health care, it says a lot. So I'd love to hear your thoughts on that.
Well, thank you for asking about that. I mean, that's really an incredible opportunity for us to make even greater impact for children's mental health. The Center for Advanced Behavioral Health is just one part of a multi-part strategy that we've used to approach addressing mental health in our community. And so we've invested significant resources in developing the Center for Advanced Behavioral Health, but also we're expanding our psychiatric services more broadly. So we're opening some new psychiatric inpatient programs on one of our campuses, which we call the Cedar Avenue campus. And in that center, we will have emergency walk-in services for families. And then we'll also have inpatient psychiatric treatment programs for kids who need more intensive treatment for kids ages 6 through 18. Now, we anticipate that will be the smallest number of young people that we treat, but sometimes in crisis, families need a safe, effective place for young people. The Center for Advanced Behavioral Health is our outpatient ambulatory, clinics, where we also have, outpatient therapists and psychiatrists. We also have what we call a partial hospital program where kids come during the day. They do their schoolwork while they're there, and they're there for a period of time until they can transition to other treatment settings. And so we're setting up more group-based interventions and all the other therapeutic tools that we have. But we're also trying to do more than that. So the other thing that we want to do, because our facility is incredible, and I do want to talk a little bit about the facility itself, because it is really, it's an incredible incredibly beautiful place. It's bright, it's open, it's sunny, and it's friendly to children, adolescents, and families. And that was really important to us because, so many of, families will tell you, so many of the mental health facilities are not welcoming. And and we did not want to reinforce that image of places that are not welcoming and friendly for families. And we've been really successful in doing that. But we also want to become a community hub. So we want to be a place where people gather from the community for education, for learning about things like mental health first aid, for learning about anxiety, social emotional development. And so we really want to be a center of community activity for mental health. And our community, meaning our immediately surrounding community of West Philadelphia, our state, our country, and our world.
Fantastic. And is it fair to say, Tami, that when you started in this field more than 20 years ago, you couldn't imagine this kind of commitment to this field? Is that fair to say? I mean, a big new facility and all this emphasis and all this support. It just seems to me, back to my first question, this is really a movement in terms of emphasis and support. Is that fair to say?
Yeah, well, it's more than fair to say. When I first started, I could never have imagined this, but actually 5 years ago, I never could have imagined this.
Really?
So,
Yeah.
It's how far we've come has been pretty remarkable. And, as I mentioned before, despite the pandemic has actually helped us highlight some of these major issues that have really driven us forward. I mean, if you think about it, it's been fairly recent, as you mentioned earlier, that athletes are speaking out about this, that, that we've had bipartisan support in Congress focused on mental health. The Surgeon General issued an advisory on mental health. These things have happened in the last 5 years. And it's incredible because we have this moment. I mean, this moment to really make a difference in the health of our children and families and our nation. We have this moment that we really have the attention of the world focused on promoting healthy emotional development. And, we really have an opportunity to take advantage of what's available to us now. And I've been really inspired by where it's coming from because it's not all healthcare. It's you having this conversation with me today. It's, our athletes talking about their own experiences. Like this is really monumental and important. So no, I couldn't have imagined it 20 years ago. And I'm still imagining so many other things happening now. So this is all this is our moment of opportunity.
Another thing that happened during the pandemic, I wonder what your experience has been. I'm up here in Maine and involved with the healthcare system here, and there was an explosion of telehealth services just by necessity and enabled by technology. I mean, I'm looking at you while we do this interview, and I naively or incorrectly thought that psychiatry would be a difficult thing and psychiatric services would be difficult to do with telemedicine. You got to be face to face and high touch and everything. And my understanding can be just the opposite, that you have folks with anxiety that would make it hard for them to come out of the house or sit in a waiting room with other people, and that telemedicine has actually been a huge gift. So I'm curious to know your thoughts, because one of the things we talk about here is that at the Optimism Institute is technology can be friend or foe. It's really how you use it. And it seems to me that this connectivity can be a huge boon for behavioral health services.
So I think telehealth has been a major advance. It was interesting because for most people across medicine, but especially in mental health, we've been trying to facilitate the development of telehealth for years. And because there was really no payment structure and no organized structure, it just never really took off. And I also think that for my generation, technology is new. For youngsters nowadays, it's just the norm. And so their experience of what is required for connection is different. And so connecting by video technology is just part of how they've grown up. And so I think that, technology provides a forum for them in ways that it might not for people who aren't accustomed to it. I think that telehealth has been really helpful. We're still kind of understanding how effective it is for some of our mental health interventions. And so, I can say in our own practice, at least 50% of the time, we're seeing young people in person anyway. It's not a replacement. And so sometimes
Right.
families will just say like, look, we think this is great, but we actually do need a face-to-face appointment because it's different.
Sure. Sure.
But that being said, it's actually made it more convenient for families. And so sometimes for me, like I see a kid in my office, but both parents can't come. And so one parent has to stay home with the other kids. With telehealth, I now get to see the dog, the other kids, the parents. Um, they can make the
Well, an
appointments.
insight into the home life, right? I mean, there's some benefit to that, I
Yeah,
would think.
exactly. I get to see the dog that I've been hearing about for a year. And
Yep.
then the whole family can join. And then, it's convenient. And so I think it's can be effective, used properly. A lot of the young people prefer a digital connection initially, particularly during the pandemic. If people were afraid of getting sick, they didn't come out of the house. I have families tell me like, look, I'm not coming there. Okay, we can do the video thing. So
Yeah.
I definitely think telehealth has been a major advantage. It's also allowed us to reach people who actually have they're deserts of mental health treatment. So for people who live far away, who have access to the internet or phone, they actually can get the service. And one of the things that we worked on is how do we expand the internet access to areas where people can't afford it or they don't have access. But it actually has been really helpful in helping us reach more people.
No, it's great. Yeah, I've seen it in Maine where you have, in the more rural settings where it's an hour's drive and you have one car and it's broken down and you miss your doctor's visit, whether
Yeah.
psychiatric or otherwise. I'd love to have young people listening to the Blue Sky podcast. I imagine it's not going to appeal as much to the younger set. So most of the folks listening in on this would be more of the sort of the parent age, I think.
Yeah.
And I'm wondering, you've talked a lot about family and family support. And I'm sure we'll have people listening who have a child who's struggling in these areas. And I'd love to hear, what advice would you give to a parent whose child is struggling with the issues we've discussed today? And what's the best way to start a process towards things getting better?
Yeah, you know what? That is such an important question. And so, I would suggest to any family that, one, sometimes it's hard to listen to these conversations because you want to think everything is fine. And as parents, we try to talk our kids out of their feelings. You don't really feel that way. Oh, well, yeah, that's just normal. I think we have to listen. And if we're not sure, and it's okay to not be sure, you should talk to your primary care provider. And I think it's so much easier for families to start with their family practice person or their pediatrician or your school counselor. Just say, this is what's happening, and ask for some guidance, because I think it can be daunting for families to pick up the phone and call a mental health practice.
Right.
Because sometimes there's a long wait list. Most families, if you have insurance, which most families do, either through their private insurer, usually there's a number on your card you can call and ask about mental health services. But that can feel overwhelming. Call your insurance company, they'll help you, but you can actually just start with your medical provider, because they actually can provide you with resources and some perspective, because sometimes it's not something you need to see someone about. It's something your pediatrician can provide some guidance for and some information. I also encourage people, if they belong to other communities. So if you belong to a faith community, we've been partnering a lot more with the clergy and with other people in faith-based communities to understand more about mental health and to know how to provide direction for families. So I would suggest reaching out to someone that you trust and running the problem past them. I mean, sometimes it's clear, like if your child is saying, I'm feeling suicidal, and you're not sure what to do, call your emergency provider, call 988. 988 is the new emergency line instead of calling 911.
Right.
And so basically, in emergencies, I'd go to the emergency department, but most things are not an emergency. And you want to catch it early, because catching things early just makes it so much easier to address them. And sometimes they are things that can be addressed in the communities where you already are. So I wouldn't panic. But I would talk with the doctor who knows your kid, or talk with the school who knows your kid, or another family member if you have somebody that you really trust.
Yeah, it's so helpful. And you started by saying talk to your physician. I think one of the challenges we have is that we have this big bright line between physical and mental health, right? So it's, well, their arm's broken or they have strep throat, they go to the doctor. And if they're acting out or they're anxious, it's a whole other world. And there's some differences in different disciplines, but it's all part of the same healthcare system, should be. And so that's refreshing to hear.
Well, that's a change.
Yeah.
It's a change. And it's really, I think it's been happening for some time in family practice and pediatrics. But I think that, with the mental health crisis we experienced, that actually was occurring before the pandemic, but was highlighted by the pandemic, has really, kind of forced all of us to think about how we can collaborate more effectively to address these problems. And so the medical community more broadly is really looking at how can they support families, how could they support their patients, the adult patients, our geriatric populations and our pediatric populations. And that's the place to start. And the advantage of starting there for most families is you already have a relationship.
Right.
And most people trust their providers. And so it's not calling some, as a child psychiatrist, I live in the mental health world. So it all is normal to me, but I definitely realize it's just not the world that most people are accustomed to entering. And, and sometimes we make it worse for ourselves, right? We use language that people don't understand. Sometimes we make it sound way more complicated than it actually is. I just think there are things that we can do to be more accessible, but I definitely find that medicine, any of the medical providers are familiar with, kind of what the things are that we need to be concerned about and know how to guide you to where you need to go.
That's so helpful. And looking at the clock, we're coming up towards the end of our time, and you have been just the kind of guest I thought you'd be, just brimming with hope and optimism while dealing with very challenging circumstances of pediatric mental health and behavioral health. Are there any things you'd like to leave our audience with in terms of this field and what gives you hope and optimism as you work in it?
Yeah, I have to say, I absolutely love my work. And I love working with children, adolescents. I love working with their parents. And they always give me hope. And they give me hope because families, families the backbone of our world. And I always remember during the tough times that nobody cares more about their children than their parents and their families. And in partnership, we can address all of the things that come up. And even for young people who are struggling with serious mental health conditions, life can be better and people can be productive. And right now, we have so many ways to be effective. And together, we see what's happening now. People are coming out to talk about their experiences and to support each other. We can overcome these problems. And so I hope that we will continue to have this conversation and people like you will continue to ask these questions because I think this is what's going to improve the mental health of our nation. So thank you for this opportunity to talk about this.
Oh, thank you, Dr. Tami Benton. It has been a fantastic conversation. It's an honor to be in your presence, even virtually. And I wish you nothing but continued success, and I'm sure we're going to stay in touch. So thank you so much for your time.
Thank you.
I hope you enjoyed our conversation today with Dr. Tami Benton from the Children's Hospital of Philadelphia. She's a remarkable person working on the tough problem of youth mental health, but bringing to these efforts an inspiring sense of hope and optimism. Please look for more episodes of Blue Sky, and if you like the stories we're telling, also be sure to check out the Optimism Institute on social media. Once again, I'm Bill Burke, and I thank you for listening to the Blue Sky Podcast.